Hello. Welcome to Nursing Basics, review for busy nurses. For this session, we will review on common patient positioning. Let's get started. Patient positioning. Patient positioning is vital to a safe and effective surgical procedure. Proper patient positioning in the operating room depends on the type and length of procedure, anesthesia access to the patient, devices required, and other factors. Safely positioning the patient is a team effort. All members of the surgical team play a significant role in the process and share responsibility for establishing and maintaining the correct medical positions for patients. Goals of patient positioning. Maintain the patient's airway and circulation throughout the procedure. Prevent nerve damage. Allow surgeon accessibility to the surgical site as well as for anesthetic administration. Provide comfort and safety to the patient. Prevent soft tissue or musculoskeletal and other patient injury. The following are some of the common positioning for surgical procedures. Supine position, also known as dorsal decubitus, is lying horizontally with the face and torso facing up. Indications. It is used in the following procedures: cardiac, colorectal, thoracic, abdominal, abdominothoracic, endovascular surgeries, laparoscopic surgeries, upper extremity surgeries including hand and wrist, lower extremity surgeries including hip, knee, foot, and ankle. Procedures on the neck and face are also often performed in supine position, as well as plastic surgeries and general surgeries. Trendelenberg. Trendelenberg position. A variation of the supine position in which the patient's head is tilted down so that the patient's abdominal organs are moved towards the head, improving surgical access to the pelvic organs. Reverse Trendelenberg position. A variation of the supine position in which the patient's head is tilted upwards so that their feet are positioned down. Reverse Trendelenberg may be used for stomach, gallbladder, and biliary tract surgeries. Fowler's position. This is the most common position for patient resting comfortably, whether inpatient or in the emergency department. In this position, the patient's knees are either straight or slightly bent and the head of the bed is angled between 45 and 60 degrees. Respiratory changes result in increased oxygenation by maximizing chest expansion, minimizing abdominal muscular tension, and minimizing the effects of gravity on the chest wall. Therefore, a useful maneuver for patients in mild to moderate respiratory distress. Lithotomy position. In lithotomy position, the patient can be placed in either a boot-style leg holder or stirrup-style position. Modifications to this type of position include low, standard, high, exaggerated, or hemi. This position is typically used for gynecology, colorectal, urology, perineal, or pelvis procedures. The risks posed to a patient in a lithotomy position for a procedure include fractures, nerve injuries, hip dislocation, muscle injuries, pressure injuries, and diminished lung capacity. While positioning a patient in this position, surgical staff should avoid hyperabduction of the patient's hips and leaning against their inner thighs. Stirrups used on a patient in this position should disperse support and pressure over wide areas. Prone position. In prone position, the patient is face down with their head in a neutral position without excessive flexion, extension, or rotation. A face positioner is used when the patient's head is in midline. Prone position is often used for spine and neck surgeries, neurosurgery, colorectal surgeries, vascular surgeries, and tendon repairs. Foam or gel positioners may also be used for spinal procedures. When a patient is in prone, pressure should be kept off of the eyes, cheeks, ears, and breast. At a minimum, 4 members of the surgical staff should be available when turning a patient prone. Risks associated with prone position include increased abdominal pressures, bleeding, compartment syndrome, nerve injuries, cardiovascular compromise, ocular injuries, and venous air embolism. Jacknife position. Jacknife position, also known as crask, is similar to knee, chest, or kneeling positions and is often used for colorectal surgeries. This type of position places extreme pressure on the knees. While positioning, surgical staff should place extra padding for the knee area. Lateral position. A patient may be positioned in lateral position during back, colorectal, kidney, and hip surgeries. It's also commonly used during thoracic and ENT surgeries, and neurosurgery. Some variations on this position include lateral kidney, lateral chest and lateral jackknife positions. In lateral position, the patient may be placed on either their left or right side depending on the side of the surgical site. A pillow or head positioner should be placed under the patient's head with the dependent ear assessed after positioning. The patient's physiologic spinal and neck alignment should be maintained during the procedure, and a safety restraint should be secured across the patient's hips. Risks to a patient in lateral position include pressure to points on the dependent side of the body such as ears, shoulders, ribs, hips, knees and ankles, as well as brachial plexus injury, venous pooling, diminished lung capacity and DVT. A pressure-reducing OR mattress or tabletop pad should be used as needed. Point 2. Fracture table position. The patient is positioned supine on the fracture table. The ipsilateral arm is elevated in a sling while the contralateral uninjured leg is placed on a leg holder. This position is well suited for excellent true AP and cross-table lateral X-rays. Kidney position. The kidney position resembles lateral position, except the patient's abdomen is placed over a lift in the operating table that bends the body to allow access to the retroperitoneal space. A kidney rest is placed under the patient at the location of the lift. Thank you for visiting. Please don't forget to like and share. Leave a comment. And hit the notification bell for our latest videos. See you on our next session. Happy studying.